This is not a topic that everyone really likes to talk about because we're humans and we don't like to think that maybe we failed at something or maybe that we're not doing well with something. But let's face it, most people that have been on a weight loss journey will tell you that there are ups and downs with it. It's usually not a let me lose weight and then it's easy and I can coast scenario. In fact, one of the biggest reasons that I see so many people in consultation for surgical or medical weight loss because there's a lot of people out there that lose weight by themselves and it just ends up being this yo-yo effect. And their weight's coming back up again for whatever reason. Maybe it's that you don't have a sustainable diet or activity program or something happens in life like a big stressor that throws you off from your routine. And then you lose ground and then you try it again. And studies have shown that the average American adult tries to lose weight at least 10 times in their lifetime. And some people are successful in reaching their weight loss goals and many are not in terms of reaching their goals and maintaining. The first thing I really want to say is that if you feel like you're having these ups and downs with your weight management journey, part of that is normal because there's a lot of factors that go into it. And also realize there are a lot of resources out there. You don't have to do this by yourself. Now you can look on my channel or with other sources from online to see that there are surgical options to help people lose weight. There's medical options to lose weight. Or you can do it holistically without any medication or surgery. Just focus strictly on the habits themselves. But if you're someone that's been in a medical weight loss program and done medications and lost weight and your weight has come back again, or if you've had bariatric surgery in the past and your weight has come back again, well, what do? There are so many people out there that are floating around, whether they've had bariatric surgery or they've been on meds through programs or through their doctor, and they've had their weight come back. And it's just kind of exacerbating that frustration that they had to begin with because, well, like, I've done a program now and I thought it was just going to work and my weight's still coming back. So, there's a lot of frustration or shame, the spectrum of normal human emotions that go into this. The first thing I think people should do is cut themselves some slack. Don't be so hard on yourself. Give yourself some grace. And if you do that, you'll stop being destructive with your thoughts and allow yourself to hit the emotional reset button and start being constructive. So this is your time to think about your problem, not get tunnel vision or feeling overwhelmed with things closing around you. It doesn't allow you to problem solve. So give yourself some slack. The second thing I would say is be honest with yourself and think about the circumstances and the situation around your experience, whether it was with the surgery or the meds, whether you feel like there's any room for improvement, either from the program standpoint or your standpoint. This is not supposed to be a let me figure out who to blame exercise. It's a way to say, well, there's something I could have done differently because maybe there were mistakes that were made or there's things that could have been done better. And I can learn from those so that when I get myself back on track, I'm not going to repeat those, or I'm going to look for a program that gives me stuff that maybe the last program didn't have. The third thing I'm going to say is set yourself up for success this time and try to create the right circumstances, the right environment, the right support system, and the right mental background to do it right this time. And what I mean by that is give yourself the best shot at success. It starts with you. You have to say, I'm going to make my health, my weight, my priority. It's really important because let's say your health is not your priority and it's other things, which it usually is, right? Then you're not going to give it your all. You're not going to give it 100%. A lot of times we're going through life and we're prioritizing other people, we're prioritizing your job, we're prioritizing whatever else is out there. So whatever is left over, we then put into our health or weight management. Unfortunately, that's not going to work because those other things have a tendency to take away your energy and take away your efforts. And then what are you left with? My point is unless you're going to make your health and your weight your top priority, it's going to be very difficult for you to do this right and to figure out a way to maintain your results. That may be hard to hear, right? But as someone that's had thousands of conversations and interactions with people in this context as a weight management specialist. So you've done the things that I've told you up to this point. You've cut yourself some slack, you drop the blame game, but also look for room for improvement from your first experience with prior bariatric surgery, prior weight management medications. And you've decided to make your health and your weight a top priority, right? And you've also given yourself the right environment, the right support system. The next step is to get help. Now, I'm not saying you can't do this by yourself because there are people out there that are able to do this by themselves, and my hat off to them, and I really mean it. People are able to lose significant amount of weight and keep it off by themselves deserve a lot of respect. The vast majority of people that are trying to lose a significant amount of weight, and I'm not talking about someone that gained 5 or 10 pounds for the holidays. I mean, someone that's really trying to lose more than that, and especially if someone has struggled even despite being in a program before with prior bariatric surgery or weight management medications. And those people would really benefit from professional help. So that's the next step in this, which is realizing you need help and then looking for resources, the right resources to help you out. And the time frame for that is really up to you. You decide when you're going to pull the trigger on seeking out and getting started with a program. It could be your own program you may have lost touch with for whatever reason, you need to get started with them again, or maybe it's a new program because you moved or because you're looking for a different experience. You'll want to look for several things. Number one is obviously the financial piece. If you have medical insurance, then make sure you know what your medical insurance will cover and not cover. And this is so incredibly important. It's one of the first things you should do is know your coverage. It's this really common belief, and I'll go over this in a separate talk, that insurance covers and pays everything. Well, that can't be further from the truth. You need to get on the phone with your insurance company. Call them up, ask them, what do you cover in terms of bariatric surgery? What are you covering in terms of medical weight loss, right? Do you cover the newer medications? Do you cover all the ancillary support that's needed? Behavioral health, dietitian, are you gonna cover personal trainer? Are you gonna help me pay for a gym if I wanna get in shape? What's my out-of-pocket expenses? Am I on the hook for deductibles or out-of-network expenses or co-pays for my visits? Sometimes you're not gonna like the answer to what you hear from your insurance company. So you don't necessarily need to stop at that. I think that if you have health insurance and they cover something, then try to work with that. But realize there are a lot of limitations to medical insurance. And the fact of the matter is that while a lot of insurance companies are going to tell you that they do things in your best interest, well, let's face it, insurance companies are out there to make the most amount of profit. So I'm going to leave this topic for another chat. I don't want to digress too much, but you have to know your insurance benefits is what I'm trying to say. And then you need to make a decision about whether you're going to try to work with your insurance or whether you're going to need to look for professional help outside of your insurance. You can either get a supplemental rider or decide you're going to pay for it out of pocket, because there's lots of ways of looking at this. If you're going to pay for it out of pocket, it's basically an investment, right? I mean, it's always an investment. You decide to go to the store, buy something, decide to get a car, you decide to pay for something for your family or your kids. It's all an investment. And how you look at your health is also an investment. In terms of the program that you pick, right? If you've had a prior bariatric surgery before, you need to be plugged in with a bariatric surgeon. Now, I'm not downplaying all the wonderful physicians out there, right? But not everyone is a specialist when it comes to bariatric surgery. So they don't necessarily understand the anatomy or the postoperative care or what labs to check or how to keep you out of trouble like someone that actually does these operations. Second consideration for picking a program is, do they offer the full spectrum of services required to help you reach your goals and maintain? And this is important. It's like I'm sure you've heard the saying, you don't need a hammer to do every job. Well, a program that only has one kind of specialist is not necessarily going to fix everyone's problems. So if you had a bariatric surgery and you're struggling and you had some weight recurrence, the answer is not necessarily another bariatric surgery. In fact, the data shows, and also anecdotally in my experience, that over 90% of the time, weight recurrence after surgery, it's usually not a problem with the surgery. So that's where we start diving into non-surgery interventions, right? It boils down to your habits, down your relationship with food, and understanding of when, what, and how to eat. Are you an emotional eater when you're stressed, or are you on medications that may be driving up your appetite? Have you been checked for any endocrine issues? How's your activity level? These are all medical approaches to overweight and obesity, regardless of whether you had a prior surgery or not, or if you're just looking to do this without surgery. It needs to be the basis of a strong and healthy foundation for you. So sure, you've met with a diet expert in the past and you went through a program, but maybe there's room for improvement. Maybe you think that you've got it down and you really don't. Someone that really doesn't know how to eat after bariatric surgery, they think they do, or there's some other thing going on, but let's face it, nutrition is 80% of weight loss and weight management, regardless of what you've done before. So does the program you're looking at, do they have robust nutritional services? They provide you with an app to log your food? Do you get feedback on your nutrition login? They offer support groups or webinars, educational sessions. Do they have behavioral health services available for you? How long does it take to get an appointment with one of their doctors? These are all things that are gonna make or break a program's ability to help you. So once you've made a list of a couple of programs that might be available for you, whether in person or online, the next step is check them out. Do your homework, do a consultation with them, see if you get the right vibe or not, and then you make your decision and you get going. And you try as much as possible to learn from any shortcomings from the first time around that you don't want to repeat this time.